right, so let's bring in our Deputy Minister of Health, Dr. Sibongiseni Dhlomo, now for the very latest. Doctor, this is such a troubling and worrying situation. 14 lives already lost from cholera, at least 50 people in the Hammanskraal area still suffering in hospital. I wonder if you could just update us on the latest you have about those who are still in hospital and the deaths.
Good evening, Sally, and good evening to your viewers. Maybe let me just start by giving what we have now as a national picture. We have one citizen who was around Hammanskraal and has moved to his home space in Messina in Limpopo. So there's one case of cholera confirmed in Limpopo. He's alive and having this infection. There is 15, not 14 now. By this afternoon, there are 15 deaths from the hospital that we visited this morning with the Deputy Minister David Mashoba and Deputy Minister Judith Shabalala. 15 deaths and 34 that are still hospitalized. We visited them and they all have got confirmed stool positive with their cholera. Sally, you probably may not be aware, there are other 6 cases of cholera in the Free State, in the place called Perez. And those ones actually are going on with the infection. They are not deaths as yet. So overall, we have 41 cases that we can actually say NICD has confirmed them through the blood, through the test, through the stools. So that is the picture we have currently. We visited the patients in the hospital Jubilee with the MEC today. They are recovering. Some of them are even taken off the drips and are now starting to take food by mouth, which is a very good improvement, because usually when they come in, they are so severely dehydrated that they are vomiting and dehydrated. They can't even take anything by mouth or retain it. So we rely on drips. But right now, some of the patients are recovering and we are really very happy about that. Let me just hasten to say, Sally, yes, one journalist asked 15, yes. These 15 are confirmed deaths because we have taken their stools and checked them. There may as well be somebody here in Hammanskraal who probably has not come to our space or might have died at home and we have not taken the culture and really confirmed cholera. So yes, it may just be bigger than what we see and what we have. Hence, we're very happy to partner with the Department of Water and Sanitation, and there are these experts that are from that department to support us, because all we need to see is reduction in terms of fecal contamination of water, because then that will give us a very clear story of improvement. However, we do give warnings and awareness campaigns. Please boil your water, but in the absence of electricity and other processes, please put the household jig bleach. It will help a lot in improving the water levels.
Are you concerned as the health department that cholera may be in the tap water? My understanding is that the City of Tshwane has done this as a precautionary measure in Hammanskraal, saying don't drink the tap water. But is it medically possible, biologically possible, that cholera could have survived all the treatment that water in our taps would have received?
Sally, from the pathophysiology, you get cholera by a fecal contamination of water. Now, whatever the source of water, which is what, by the way, the Department of Water and Sanitation is actually saying, they are saying there are potentially 3 sources of water that support that area. Now, they have to go and investigate and test those 3 sources, because there is no way you can get, this is not spread by COVID through like airborne. It is actually a fecal, there has been a mixture of fecal material, feces, with some water that the people drink. We don't know what the source is. Some experts will actually get that sorted out. So, but we can confirm that that's the only way of getting cholera is through fecal contamination or drinking contaminated water, using it untreated, either through boiling it or through putting bleach, or having been properly treated by a municipal treatment plant.
You said there are 3 potential sources. Just run those through for us, please.
Look, there are three. I don't know them well, but what is supplying that area is coming in from three streams, according to the Deputy Minister of Water and Sanitation. I was taking notes, but I can't remember. I don't want to start giving wrong names.
So just to be okay, so I know that the NICD is doing testing, and the National Institute for Communicable Diseases falls under the Health Department. So are they testing? Obviously, they're testing rivers, they're testing, everything, every water body of water, but they're also testing tap water. Is that correct?
Yes, they are.
Okay, so there is a chance. Is there a chance that cholera could have actually stayed in the tap water and be present when you open the tap in Hammanskraal?
Hence the advice that the mayor and councillors are giving to the citizens that we're not sure, we cannot confirm the safety and the quality of our water from the taps. That is what they say. Look, from our side as health, we would really go along with what they are saying. So that precaution, saying to them, and what actually the Deputy Minister of Water and Sanitation was confirming, please treat this water as probably unsafe, put jig on it, or boil it, and therefore use it for any other method other than drinking it as is, maybe boil it first. So we take that precaution. They are the experts in doing the test. We just receive.
I hear you. I do want you to perhaps help us interpret this from a health perspective. The MMC for utilities in the city said this, Themba Forsi said this a little earlier. Let's just take a listen.
The Themba water treatment plant is safe and is tested negative for the coronavirus, cholera remnants, and we have gone as far as testing other areas, even our reservoirs, to make sure that the proper due diligence is done, and as I can tell you, that all tested negative.
All right, so there's the MMC saying that the Themba water treatment plant is safe. That doesn't mean, does it, that everything is safe? Just interpret this for us, because it seems to be contradicting, telling people not to drink the tap water, but then you've got the MMC saying, no, the water from the Themba treatment plant, we haven't picked up any cholera.
Yes, Sally, that Themba treatment plant is one of the three that I've talked about.
Right.
I'm not sure whether the MMC is talking on behalf of all three treatment plants.
He was specific about Themba. Yeah.
Yeah. All it says that the Department of Water and Sanitation also would like to conduct additional tests of the other two, including this treatment plant, and confirm. Because there's no way you can have cholera other than drinking water that is contaminated. Now, we don't know, and the citizens of that area will indicate to us where they're getting that water from. They're either getting from the taps or from the tanks. Whichever source they are getting water from, that water seems to have been contaminated with fecal material.
All right.
That has got cholera in it.
So just a quick medical question then. Can you get cholera? Let's say someone in my home has got cholera and they pick up a cup and then I pick up the cup and drink from the cup. Can I get cholera from them, or is it literally only from drinking water? Just break it down why it seems to be so infectious.
When there is that is why we always, if we're to be handling food in the family and the house, you have to actually make sure you wash your hands, and you also wash your hands before and after preparing the food, because if there could be any contamination from you having been from the bathroom and you come back with some of your fecal material and you have got cholera, probably not giving you any problems because your body, we call you a cholera carrier. You are carrying it with you now. It's probably making you not ill anymore. And then you flush it into our salads or any food. And then we ingest that. Then we are going to get that contamination into our food because of you handling the food which got Vibrio cholera in it. It may not be giving you problems because you are already a carrier, but we would get it in that space, in that way. I
understand. Thank you. That does help. So it actually can spread quite quickly in that way. You've mentioned that there's a national concern, and obviously you're looking at the health of the whole country. I want to ask how concerned you are from a sort of a national health emergency perspective. How much alarm, how much caution should those of us not in the Hammanskraal area be taking? Because it does seem to be such a lethal disease. Just explain why it's so lethal, and then give me, just tell us how concerned you are from a national perspective on this.
Sally, you'd recall maybe that when there was these cases that were reported from Malawi into our country that were found in Deep Sloop, already some of the in Alexander, we actually sent an alarm to the country to say, be alert.
And you've been monitoring it, yes.
Alert, make sure that, and we have heightened that to say, any person in the country who is reported to have diarrhea, let us improve our suspicion and treat it as if it is cholera. Because why? Because cholera dehydrates you so quickly, and the real cause of death of most of our patients is because they are so severely dehydrated. We are looking for ways to give them fluids through drips, and it's just collapsing. So it is such a quick way of dehydrating a person, cholera, much more than any other diarrheal diseases. But we are actually saying, let us improve, because you may as well have someone in the house with cholera, but washing of the hands, making sure that there's personal hygiene of everybody in the space. But if you are drinking water that you are not sure of, suspicious of maybe contaminated, please let us boil it. In the absence of enough electricity or this, please put some bleach in there, then we'll be able to say we are likely to be safer in that space.
All right. Very quickly, the NICD test results for water in the entire area, is it going to be out by Wednesday? That's what I've heard. Is that correct?
That is the information, Sally, that they've actually told us about. They will update us if there are changes, but they continue even now. If there's a new patient coming in today, they also do the testing. So their work is cut up to be much bigger than they could probably think of. So they are actually giving us an update on Wednesday about results, but continuously monitoring any patients that walk into our hospitals and around the area.
All right. Thank you so much for that update. That's our Deputy Health Minister, Sibongiseni Dhlomo.